In this lesson, we'll review California's Medi-Cal program. After viewing this lesson, you'll be able to describe who is eligible for Medi-Cal, recognize programs administered by Medi-Cal, list different methods for verifying a patient's Medi-Cal eligibility, describe how Medi-Cal applies a share of cost to some patients, and explain key differences between regular Medi-Cal and Medi-Cal managed care. Medi-Cal is California's Medicaid program providing medical care to low-income families with children, people with disabilities, pregnant women, and some other groups. Starting in 2014, Medi-Cal will serve low-income adults up to 138% of the federal poverty level. Medi-Cal has traditionally been financed with 50-50 state and federal matching funds. Newly eligible low-income adults without children who start Medi-Cal in 2014 or after will be federally funded as part of the federal health care reform law. California's Medi-Cal administers several different programs besides the regular Medi-Cal program. These include Medi-Cal Managed Care Plans, Family Pact, the Child Health and Disability Program, or CHDP, the Breast and Cervical Cancer Treatment Program, and a women's health program called Every Woman Counts. For the purposes of this training, we'll focus on Medi-Cal and Family Pact. When a Medi-Cal patient comes to your clinic, you'll need to verify their eligibility and benefits. This can be done 3 different ways. We'll walk through each and why you might prefer one method over another. The first method is called a POS. This method uses a card reader device that reads the Medi-Cal card automatically. Or you can manually enter the Medi-Cal eligibility information. The advantage here is that you can swipe the patient's Medi-Cal card without keying in any numbers. And if your internet happens to be down, you can still use the POS. A disadvantage is that the paper tape used in POS devices tends to fade quickly and can become unreadable over time. The second method is verifying the patient's information online on the Medi-Cal website. This method tends to be relatively quick and allows you to print out a copy for your files. A third method is using Medi-Cal's Automated Eligibility Verification System, or AEVS. This is a phone call to a Medi-Cal 800 number. An advantage is that you'll find out in real time the patient's eligibility status and whether the patient has a share of cost. Also, you can always use this method if your computer system is down or you don't have an operating POS device. A disadvantage is that you must follow a series of automated phone prompts that can take some time. Each of these methods and how to access them are described on the downloadable job aid on Medi-Cal Eligibility Verification. Once you've chosen how to verify your patient's Medi-Cal eligibility, you'll need to interpret the information that you receive. The image here is a sample of an eligibility printout from a POS. The downloadable job aid interpreting Medi-Cal recipient eligibility will help you decipher the information you get from Medi-Cal so you're able to confirm what services the patient is eligible for as well as coverage for the day of the visit. Medi-Cal clients with incomes too high to qualify for cash assistance can still receive Medi-Cal benefits for health services. Their plan requires them to pay a portion of the cost of services each month before the benefits from Medi-Cal kick in. Medi-Cal calls this share of cost. It's similar to what you would think of as a deductible. It's important to understand that the share of cost must be paid each month and starts over each month. The details discussed, including verifying and clearing share of cost, are available on the downloadable job aid, Medi-Cal Share of Cost Tips. Medi-Cal clients pay the share of cost to the provider, not to the Medi-Cal program. The amount the patient will owe is determined by Medi-Cal based on the patient's income. Because the share of cost amount varies so much from patient to patient, and because you need to track how much a patient may owe during any given month, you'll want to verify if the share of cost has been met at each clinic visit. It's the responsibility of your clinic to document if and when the share of cost has been met at the time of the visit. If you don't clear the patient's already met share of cost, the patient could be asked to pay these same fees over again if seen elsewhere. Your diligence will help patients prove they are already paid up.
Hi, Athena Kinsley, Health Insurance Specialist here. I'm going to help show you how Medi-Cal share of cost works by walking through a sample scenario. Imagine a patient, Mrs. Ramon, comes to your clinic. Let's say your clinic's fee schedule sets a total charge for services at $200. The registration team verifies the patient's Medi-Cal eligibility and finds that Mrs. Ramon has a $100 share of cost. At this point, you will need to explain to the patient that the service total is $200, but she's only responsible for $100 today. Once the patient pays the $100, the accounting team clears Mrs. Ramon's share of cost. Now, she'll be free from any more Medi-Cal fees for the rest of the month. Let's assume her services are covered by Medi-Cal. In that case, the Medi-Cal program will reimburse your clinic the remaining $100, or whatever their usual rate is for that service.
Medi-Cal Managed Care is an organized system available in some counties and communities. It offers a network of doctors, pharmacies, and health education programs for its enrolled Medi-Cal patients. Each Medi-Cal Managed Care enrollee has an assigned doctor and clinic as a primary care provider. Patients may change their provider assignments, but must stay within their Medi-Cal Managed Care plan's network of providers. It's possible for your local health department clinic to serve Medi-Cal Managed Care patients as an out-of-network provider. This generally requires a Memorandum of Understanding, or MOU agreement, between your health department and the specific Medi-Cal Managed Care plan. You can download the Job Aid Template Medi-Cal Managed Care MOU to see a sample version. Like other HMOs, Medi-Cal Managed Care plans agree to provide specific services to enrolled Medi-Cal clients for fixed rates. There are some differences in covered services between traditional Medi-Cal and Medi-Cal Managed Care. This will mostly not be an issue for your public health clinic immunization services. However, there are a few services that Medi-Cal Managed Care will not reimburse, but patients can still receive coverage from regular Medi-Cal. Direct observation therapy, or watching a patient take medication, is commonly not covered by Medi-Cal Managed Care, but is covered by regular Medi-Cal. By following the rules, we'll explain how you can still get reimbursed.
Hi, this is Athena Kinsley, Health Insurance Specialist, here to give you an example of Medi-Cal Managed Care carve-outs. Let's say Nurse Margaret goes to Mr. Grant's home for direct observation therapy. Mr. Grant has Medi-Cal Managed Care coverage, but direct observation therapy is one of the services Medi-Cal Managed Care doesn't cover. So, instead of billing Mr. Grant's Managed Care plan for the service, you should bill his service charge directly to regular Medi-Cal. This way, the state Medi-Cal program will reimburse your clinic for Mr. Grant's service. That's because the Medi-Cal program still honors DOT as a covered service. This is true despite restrictions applied by Medi-Cal Managed Care plans.
Now please follow the instructions to take the quiz for this lesson. It'll look familiar. It's the same one you took before viewing the lesson. This time you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.